PressTo is a medical device for bone marrow biopsy manufactured by MDL, designed and developed to reduce patient discomfort and to increase samples quality. The device is composed by a T-handle that allows the operator to firmly and comfortably hold the device, an inner stylet, an internal catching system, and an external cannula. Additionally, the device is supplied with a measuring wire, a removable luer connection, and a needle tip protection. To correctly use the device and ensure a safe and successful biopsy, please make sure to follow the following instructions. Verify that the safety lever under the handle is completely inserted into the handle body. Insert the needle and advance it forward until you feel a noticeable resistance that indicates the reaching of the bone tissue. Firmly hold the device perpendicularly to the point of insertion, and by repeating clockwise and counterclockwise motions, enter the bone. Keep repeating the motion until the resistance drops, at which point you have reached the marrow cavity. Holding the device with one hand, extract the trocar by rotating the closure lid of the device counterclockwise. If needed, attach the syringe to a luer lock attachment and perform an aspiration of the marrow blood. Screw the cap on top of the luer connection to avoid leakage of blood from the luer lock connection. Push the device further in. As you do that, the sample enters the cannula. Unscrew the cap from the top of the device and use the measuring wire to determine the length of the sample. The measuring wire has 4 marks. The first mark indicates 0 mm of sample length. The second mark 10 mm of sample. The third mark 20 mm of sample. And the fourth mark 30 mm of sample. If the length of the sample is not satisfactory, screw the cap back on and push the device further in. Measure again. Once reached the desired lengths, pull the safety lever distally from the device body. Push on the cap to advance the catching system and grab the sample. At this point, the sample is inside the catching system. Rotate the needle 360 degrees, doing a complete rotation, multiple times in both directions. To retrieve the sample without extracting the device, push on the safety lever. Pulling from the cap, extract the catching system from the device. The sample will be located in the notch. To remove it, unfasten the cap, insert the extraction wire into the plastic hub of the catching system, and push carefully the specimen out of the tip. PressTo allows to take multiple samples without extracting the device from the bone. To perform another biopsy, insert the catching system back into the device. Advance PressTo further into the marrow, checking the length of the new sample using the measuring wire. Repeat the process as done the first time, retrieving another sample. If the operator wishes to, an aspiration can be made without impoverishing the biopsy samples of blood cells. Attach the removable luer connection, supply with the kit, and attach a syringe to suction the marrow blood. Once all the samples required have been obtained, carefully extract the device from the bone. If part of the specimen remains inside the cannula, insert carefully the safety device over the tip of the cannula. Then, insert the extraction wire inside the tip of the cannula, pushing the tissue out of the needle from the body of the device.